You're watching Pyro Media Network.
What is going on, kings and queens, and the entire spectrum in between? It is another episode, well, actually segment of Kwame Speaks Daily. And I want to talk to you guys a little bit about what's going on with some of the administrations, this current administration's implementations of their policies, and just gutting these programs that are beneficial to our communities of specifically of color, but communities all around, and the disenfranchised communities that we have going on. Currently, right now, I don't know if you guys have known or have listened or follow suit of what's going on. I know there's so much happening, and there's a lot of flooding the zone, but the CDC, there was detrimental and almost catastrophic slashes to the CDC's HIV prevention programs, right? And so the administration of Donald Trump has hollowed out one of the federal offices aimed at ending the nation's HIV epidemic. And so the move comes as the administration has also cut hundreds, and I mean hundreds, y'all, of grants that were funding HIV and AIDS research. And for those who may be under a rock, this is not anything really new. We have seen a major attack, and towards science, towards medical progressiveness, towards a lot of things that make sense when it comes to progressive thought, when it comes to just the medical industry. And so there's a lot of we have somebody in the office that that doesn't even believe in vaccines. And so there's a lot of issues. There's a lot of issues here, but I don't want to delay any longer. I brought on a phenomenal human being. You may have seen him on Conversations with Clergy. He has over 20 plus years of HIV prevention, advocacy, and is just an overall dope human. And so without further ado, I want to bring on Dr. Donta Morrison, aka Dr. Donta, as for those who are nasty. Let's bring him on. Dr. Donta, what's going on, sir?
Nothing much, man. How are you? You?
I am blessed and highly favored. We're hanging in there, man.
Thread. It is a thread. We're not little people, so
no.
Threading.
Struggling. but I want to talk to you about, because I think a lot of times we can get into our feelings, we can get into spaces where we are just frustrated with things that are going on. We don't like what's happening. We may not like the person in the office, but there's a lot more at stake than just not liking him because he has a weird toupee. And I think it's important for us to kind of really focus on the policies that are really showing signs of dictatorship and oligarchy, and really showing signs of our freedoms that we fought over this small amount of time, that we've been a nation, and they're kind of slowly being dismantled. So can you first explain to me and to the world, for those who may not know, who Dr. Donta is and your advocacy and your background as a community change agent and HIV prevention advocate?
Sure, would love to. So I am Dr. Donta Morrison. I've been working basically in the field of HIV education, prevention, treatment since 2002 officially, but 1999 is when I was diagnosed with HIV and started my journey of awareness, not only for myself, but for people like me who honestly had no idea how HIV was impacting the Black community. Specifically because there was not a lot of information generated specifically towards us, or at least within my friend circle. Over that time, I've worked for a lot of nonprofit organizations to really provide education and man, recalibrate ways to approach the awareness model. Because, talking to Black people about sex, that within itself is a chore. But then talking to them about sexually transmitted disease such as HIV that is correlated to a specific community that many Blacks already demonize and alienate and ostracize was something together different. In addition to that, I do a lot of work within the faith community. I work with the churches to better understand how they can approach the topic of human sexuality, sex, sexual health, to make sure they're not demonizing individuals that are looking to them for support. If a person living with HIV just so happens to be gay, same-sex attracted, and they go to their place of worship for comfort and solace, but they're further ostracized or demonized, then that means the church is not doing its part as being a community center. So I do a lot of work in that area. I'm also, outside of that, I own a streaming platform called Watch Them that I direct, produce, write, create films specifically towards the Black LGBT community. I have 3 books out. Whoa, ooh, look at that. 3 books out. My latest is called Faithful and Forgotten. We can talk about that later. But just from my work within within the community space about HIV, I am passionate. And despite what is happening with this current administration, I see that people like myself are all the more needed because basically the money's gone and we doing this for free again.
Yeah, and Dr. Donta, first of all, thank you so much for all of the work that you do and continuously do. A lot of times, I always tell people this is a thankless job, and a lot of times people don't realize the amount of work, time, effort, and finances that goes into the work that you do. So thank you so much for dedicating your life to this. And so it's very important. We need more of you out there. I know since working with you back at some organizations that you've been a part of, and just, you just kind of shown me a little bit more in breaking out my knowledge and awareness, and even some of my stigmas that I even had, in not knowing fully of what was going on, how much it impacted, because I just was like, oh, well, there's PrEP, there's stuff like that, but I didn't realize how much of that was not known to the average human, right? And so those things were allowed to be done, especially when we have disenfranchised communities like African Americans, Latinos, all of these other communities within the LGBTQ community, which wasn't marketed to. Those funds that were pushed out were funds that were utilized by yourself and other organizations to help promote those information and get the information out there. And so what does this mean when you see all of these cutbacks and you working as hard as you have been working and talking to some of your other colleagues in the community, and as well as, in the advocacy world with you, what has this mean, or what does this mean to them, and how much does it greatly affect them?
It affects us. It's a reality that we have to stomach, and I think that it's multi-tiered. So for me, as one who was on the ground floor, literally working in the community, walking the streets, I think that it hits me differently because a lot of this work is based upon passion and a love for people. And when you have a love for people and a passion for people, specifically within a certain demographic, you don't really do it for the money, but the money is good, and it's like, I need the money to survive. I need the money to eat, for housing, whatever, but I don't do it for the money because I see there's a problem. And then we end up, people that work in the HIV sexual space, we box ourselves in because now all we know is HIV. And we may bounce from organization to organization, from local to national to federal and whatever. We move around. But when you pull the bottom out of everything, it's like, I can't even call my homie for a job now because my homie lost their job and that organization is now defunded. So where am I going to go? Because my entire resume, I have a 20-year resume all within HIV.
Yeah.
Everything I have done over the last 20 years is related to HIV, whether it's research, prevention, education, linkage to care. It's something about HIV on my resume. Thank God that I am a PhD and I have other skill sets and I'm a tad bit more marketable. But when you have people who have dedicated their lives to this particular space and in one fell swoop or one signature, their legacy is gone. Their
Yeah.
legacy of work is gone. Imagine the researchers and the scientists that were one day in the lab fighting to find a cure, and the next day the doors to the lab is locked.
Yeah.
So what do we do? What do we do? We can't access resources. We can't access information. We can't access our laboratories. We can't further the development of vaccines. We can't do anything because one person, one administration believed that this cause is no longer needed.
Yeah.
It's a slap in the face.
Yeah.
The unemployment level, I mean, they didn't think about that. And they clearly did not think about the other side of defunding this work, because you take away the resources needed to further the wellness and education and prevention of HIV. What's going to happen? Infection rates are going to skyrocket.
Yeah.
And when they skyrocket, that's more money being spent on medical costs.
Right.
So now, when you think you're saving money or stripping this so we can have money over here, no, it's one of the dumbest moves that I have seen within the last 2 months, and there's been a lot of dumb moves. But
That's an understatement.
yeah, to literally gut federal funding for a virus that is still a pandemic.
Yeah.
It's not as if HIV is anywhere near being cured, anywhere near on the decline. But to strip money from that globally, I have no words. I have no words.
Yeah, and I was going to ask you because, like, not only does one, who is in the field have to worry about their own, livelihood and things of that nature. They don't really have a lot of wiggle room because you just explained, they've grown up to become an expert, in that field. They don't have a lot of wiggle room because it's affecting everything. This is something that happened with the DEI initiatives. When we had all of these, DEI experts, and consultants running around in companies that were running around doing all of these things for these companies, and then in one fell swoop, almost overnight, they no longer have places to go or jobs and income. And so this is a critical medical issue that's ongoing, and it's not like somebody was just saying, oh well, I just don't believe in this. It's something that's affecting people in such a way. And so my question then becomes, what does this mean for those who have been service? We talked about those who have been doing the service, right? Who are there to serve. But what do you think is going to happen to those who have been receiving the services from these organizations and people like you?
Well, for one, the wait times are going to increase. The wait times for care are going to increase. The wait times for testing is going to increase. All that stuff is going to increase. So people living with HIV already were like, okay, well, I need to find a safe space to go because I don't want to be outed. I want to go where I'm seeing myself, behind the receptionist desk. I want to go where I am welcomed. Well, think about the overcrowding now. Just overcrowding. Think about how long it's going to take to get an appointment because the rates of infection are on the rise. They're on the increase. Think about all the critical care services that people will now have limited access to because they're going to be so overwhelmed.
Yeah.
I don't want to compare it to COVID. And I was alive when the AIDS epidemic first hit in the 80s. However, I don't recall it. I pray we don't see something similar in 2025, 26, 27, where people are dying in the hallways of hospitals because they can't access care because they tested positive and had no idea because they didn't even know they should get tested, because there's now no prevention services happening. So there's no one out on the streets doing outreach. There's no one out there talking to the people. They have no idea how HIV is even transmitted. We're talking about 2025, and I'm still doing workshops educating people on how HIV is transmitted because people still have no idea, because HIV education is not happening in our public school system. Some school systems in LA don't even have health. They don't even teach them health. So how are they going to learn about sexual health? They don't know the importance of brushing their teeth. They don't know anything. So doing these little pocket workshops and interventions, trying to get people aware and to understand what's happening is necessary and it's vital. I did a workshop this past Saturday to some high schoolers, and I'm talking to them about HIV, and they're just looking like, wow, what? Then I added, are you guys watching the news? Do you guys watch the news? Do you have any idea what the current administration is doing when it comes to HIV funding? And they were like, no. I said, well, sit down with your parents or your caregivers, and I want you guys to watch what's being gutted, because you may think this does not affect you, but it does.
It does. There
are countless people walking around saying, well, that's not my problem. I don't know anybody that has HIV. Just start wearing a condom. This is going to be such a huge trickle-down effect that those who thought they had nothing to do with this are going to be impacted by the outcome.
Yeah, and it's such a shame because, what's crazy to me is like, one of the things that I talk to a lot of financial advisors and experts is that this administration is trying to gut certain services and certain departments only to have them privatized, but the HIV prevention field and area was already doing that in some way, shape, or form, because you couldn't go to your regular doctor, and because they weren't either equipped or understood what PrEP was, or they weren't pushing PrEP, and so you went to a specialized clinic or specialized location like Planned Parenthood, like APLA Health, like the Black AIDS Institute, like the LGBTQ centers, and so many different organizations, the Ahmad Institute, and ACQC in Queens, New York, all of these different organizations that are all over the country that were doing what they're claiming that they want to do, which is privatize these type of situations. But then you got the grants that were for them. So then where do they go? It's just crazy to me. And it almost feels like it's a huge step back because it took so long for people to even know about PrEP, for even people to even know how to have safer sex practices, for people to even understand how to even contract these type of situations. And it wasn't just HIV that people were educating people on, or people like you were educating people on. We have a measles outbreak right now. We had a monkeypox outbreak last year.
F. Kennedy,
right? None of that.
According to him, just put all the kids in the same room and let them catch measles at the same time
and take vitamin C.
That's chickenpox. That's chickenpox. There was a friend of mine, Daniel Driffin. He posted this image that MSNBC shared, and I guess it was a poll that the Kaiser Family Foundation had did earlier this year. And it asked, who do you trust for your healthcare knowledge, something like that. And people it was like 84% Donald Trump, 80% Robert Kennedy, 80% Mehmet Oz, 80% my private doctor. And then the lower one, it had 40% CDC, 40% NIH, 40% this. Now, people, do you realize that lower level, that 40%, that's who funnels the information up to that higher level? So the people up top that you profess to trust more about your healthcare, they get their knowledge from the CDC, the NIH. That's where they get the information from. So defunding those organizations, that top tier, they're going to make best guesses that's not rooted in any kind of science, any kind of learning. Robert F. Kennedy is not a physician, not a doctor. Donald Trump is not even a human. So it's like you're relying on people that have no kind of skill set, intellect, knowledge in these areas to decide how you're going to live. These are the same individuals that are attacking women's health, transgender health, now the health of those at risk for HIV. I mean, it's infuriating where we're at in this country, and we're supposed to be the smartest kids on the block.
We're supposed to be the leading experts on all of this stuff, and it's sad.
There's nothing we can say that's going to even make me allude to the fact that we know what we're doing, because right now our administration is a cabinet full of idiots.
Yeah, and this administration has already proven that they're not good with handling epidemics or pandemics, for that matter. So I'm not even going to to even pontificate on that, but we'll move on. But I want to thank you so much, Dr. Donta, so much for the work that you've done, continue to do, and just keep hope alive. That's all we can do, is just kind of really focus and just hope that God knows what he's doing and that he's still on the throne. And that's all I have faith in, is Jesus at this point. At this point, we gotta leave it in his hands. But for those who may not know, or may want to even help with services and the things that you do, and may want to provide you grants or provide any type of support, how can they find you?
Just hit me up on well, first of all, go to my website, DontaMorrison.com. I keep it simple. It's not bigthickdude.com. No, it's DontaMorrison.com. I'm a real doctor. I have a PhD. Now, I'm not a medical doctor. I have a doctor in basically social empowerment. So that's my PhD from Pepperdine University. It's a real school. I'm not honorary. Really got a doctorate. That's first. Secondly, just follow me on Instagram. Dr. Donta on IG. I'm on TikTok. For however long that's going to last, I'm not sure, but you can always just find me on those spaces in Facebook, LinkedIn. Those are my go-tos. I'm part of that generation still that's holding fast to Facebook. If it was still MySpace, I'll be on there too. But just hit me up. I am someone that does write back. I do believe in social media as a form of social engagement. So you're not going to write me, I'm going to send you to a spam folder. No, I will reach back out, because we're in this together. I know we don't understand how much we need one another right now, but this is not the time for infighting. This is not the time for all the little penny stuff that we usually argue about. We got to come together, because we all we got. They ain't thinking about us. They try to just erase us, like literally erase us from history. But we got to come together, and I'm about it. So just hit me up and let's talk.
Yeah, and there's nothing else I need to say on that. That's the truth. We need to come together, and I appreciate you for your continued work. Like he said, hit up Dr. Donta at DontaMorrison.com. Make sure you find him on all social media platforms at Dr. Donta or Donta Morrison. You can find him. He's very easily to be found. You can check him out. And also check him out right here on Conversation with Clergy, right here on Pyro Media Network. So definitely check him out there. All right, y'all. Thank you guys so much. Stay blessed, stay stress-free, and we'll see you on the other side. Good luck on this administration.
Thank you for watching Pyro Media Network. For more information, please visit pyromedianetwork.com.